We are joined by Dr. NGOY NSENGA. He is a team leader for the World Health Organization Emergency Program at the Emergency Hub for East and Southern Africa. Dr. NGOY NSENGA, thank you for joining us here on the link. First and foremost, let's dig into these fresh concerns that Ebola patients and Ebola survivors die a year after leaving the hospital. Talk to us about that.
Yeah, thank you very much, and thank you for having me. It's true that, as you said in the introduction, there is a study that has been was conducted in Guinea on survival of Ebola. And the study showed that in the first year, the survivor had 5 times the risk of dying than the general population in Guinea. And also the same study showed that 60%, that was 37 out of 59 of those who died, had kidney problems. That's what was seen in Guinea. Now, that said, that's why it's very important to put in place, and that's why WHO put in place a program to follow up survivors, to follow up their health. It's not that when they are discharged, they are left alone and no one is looking after their health, but there is a whole program which is following up their health. So in DRC, we have put that program in place, and colleagues in the field are following up survivors.
All right, doctor, let's expand on that. From your perspective, is there a way of treating Ebola patients in a way that will enable them to live longer?
I think there's now a little bit of difference in terms of treatment of Ebola. In the past outbreak, I mean earlier on in the 70s and even 80s, we didn't have any medicine that was treating, say, Ebola. But now, I think you've heard also through the media, including yours, now we have a molecule that is giving to, medicine that are given to Ebola patients and have been now demonstrated to be very effective in treating Ebola. So after for the Ebola survivor, after they've been discharged from the hospital, that's why now we are putting in place this program to follow up their health so that we can help them not only to survive and to live longer, but to live a healthier life longer as anybody else would like to live a healthier life.
All right, very briefly, doctor, talk to us about the situation in the DR Congo. The latest figures show 1,000 people are surviving the disease. Talk to us about that.
Yeah, the situation, I think, from my perspective, is encouraging, because we've gone from where we had around 20 cases per day to today we are having in average 3 cases per day. So it's encouraging. However, we need to put a word of caution here, because we know that there are still areas or portions of geographic places where it's difficult for colleagues to follow up patients because of security issues and security challenges. So those areas can be pockets of infection. So that's why we have to put this word of caution. But in general, I think the situation is encouraging.
All right, Dr. NGOY NSENGA, thank you for your expertise on the matter. So many questions, so little time. Hope to speak to you again real soon.